Sally Purdue, and welcome to WCU NG News. We are live here at the Good Samaritan Clinic of Jackson County, bringing you the most recent updates on the community health front. It has been reported that community health is anything that focuses on different characteristics of biological communities. Its main purpose is the prevention of the occurrence and spread of disease. Now we will head back on over to the patient experience, where we will get a synopsis on what kind of centers would classify as a community health.
Welcome back. After looking into many sources, we have found that community and public health is a wide range of treatment options and facilities. Community health is anything from a visit with your doctor's office to receiving a flu shot at your local clinic to even hospitals and long-term care facilities. These places provide a variety of public health treatments. Community and public health tends to focus more on the community as a whole rather than special individual needs. This means that community health services can range from simple flu shots and post-surgical care to things such as educating the community on the prevention of diseases. We are able to step inside the Good Samaritan Clinic here in our own Jackson County and see for ourselves what a patient might experience at this type of facility.
After looking into many sources, we have found that community health and public health is a wide range of treatment options and facilities. Community health is anything from a visit with your doctor's office to receiving a flu shot at your local clinic to even hospitals and long-term care facilities. These places provide a variety of public health treatments. Community and public health tends to focus more on the community as a whole rather than specific individuals. This means that community health services can range from simple flu shots and post-surgical care to things such as educating the community on the prevention of disease. We are able to step inside the Good Samaritan Clinic here in our own Jackson County and see for ourselves what a patient might experience while visiting this type of public health facility.
Hello and welcome back. You may be wondering, how is the Good Samaritan Clinic a community health clinic? Well, we went to Rebecca Mathis, the executive director of the clinic, for her input on the matter.
All right, well, it sounds like that you want to know about how the Good Samaritan Clinic is a community health clinic. We are Jackson County's medical safety net. And so what that means is that we're really here to provide primary care for people who don't have anywhere else to turn. So we serve people that are between 18 and 65, so folks who don't qualify for Medicaid, they don't qualify for Medicare, and they don't have any private health insurance. So they're uninsured, and they're also they're economically disadvantaged. So a lot of times we take care of the working poor. A lot of our patients work. We serve folks that live in Jackson County and all the counties west of Jackson. So 6 counties in western North Carolina is our main focus group.
This is Holly, a new patient here at the Good Samaritan Clinic. In order to become a patient, Holly must have met all the criteria and filled out an application that was to be accepted by the clinic before she could make her appointment. Since she is between the age 18 and 65, has no insurance, and falls between the 175% poverty level, she was accepted as a new patient by the clinic. Holly has came down with cold-like symptoms and has made an appointment to get treated. We will follow her through the beginning stages of her appointment.
So, what is your name?
Holly Pennell.
Holly Pennell. Holly, do you, have you had any symptoms that, as well as the cough?
No.
Wheezing, stuffy nose, sore throat. And then sore throat. And then, have you seen what color mucus yours? Yours?
Green.
Greenish green. And then, how long have you had these symptoms?
About 3 days.
3 days. Okay. And is how often are you coughing? Like, how bad is your cough?
It's pretty bad to the point where I'm bending over, and
It's like a hacking cough.
it's a hacking cough, yeah.
Okay. And then have you had any fever associated with these symptoms?
No.
No fever. Okay. And then, are you allergic to any medications?
No.
Do you have any other allergies?
No.
And then, what are your current medications?
Albuterol inhaler for asthma.
And then, do you know the dosage on the?
2 puffs before exercise.
And then, do you take any other prescription medications?
No.
Do you take any other supplements and vitamins?
No.
Okay. For fun's sake, let's say you take a multivitamin twice a day.
Okay. I take
Or
a
once a day.
I
Okay.
take a multivitamin once a day.
I'll give you guys an explanation in a minute. Okay. So are you diabetic?
No.
Do you smoke?
No.
So what we're gonna do is we're gonna take your blood pressure first off. Pretty good. And then awesome. Then we're gonna get your temperature. So I'm gonna just put it at your forehead. Nice, because that way it doesn't get a bunch of sick germs on anybody. I don't want anybody to have your cold. And then we're gonna take your O2 saturation. See how much oxygen is in your blood. And then D8 is good. Alright. So at this point, what I would do is I would go out and see if there is a room available for you. And this is the patient intake room. So what I would do is I would take you to a regular patient room, and then that's where you would wait for a provider. If all the patient rooms were taken up, then I would set you back outside, and then someone else would call you back in and set you in a provider room, and then you'd have a meeting with the provider to go over your cough or whatever ailment or illness you have. Yeah, that is what you do for patient intake.
So with respect to the question of how we would approach in our clinic here at the Good Samaritan Clinic, a patient who presented with kind of a routine problem with a head cold or chest infection, how the approach is different here than in the emergency department where I also work, or in urgent care, which I occasionally work in as a substitute. Our approach here is to emphasize the importance of establishing a medical home. So although we want to help the patient with their cough and the runny nose, make sure that they don't have a problem like pneumonia, that we're going to dig a little deeper and make sure that we address some preventative medicine issues of health maintenance. If it's a young person, we'll talk about everything from seat belts to nutrition to safe sex. If it's an older person, we talk to them about cigarette smoking and self-care and when was the last time they had a mammogram or had their cholesterol checked. That approach would be different than in the emergency department, where our goal is to try to stabilize the patient and get them in one of several places as quickly as we can, to another hospital, admitted to that hospital, or sent home. Kind of get out of my ER as fast as you can so we can put somebody else in that bed. That's not the approach in primary care. Our goal here would be to get the patient to feel comfortable here with all of their health concerns and let them know the importance of preventative medicine. If you think about it in the model.
Overall, the Good Samaritan Clinic has proven to be a community and public health service. It provides care to a part of the community that is otherwise neglected, but yet here they are seen with the same quality and respect as anybody else. This clinic provides primary care as well as education to their patients and the community around them about the prevention of disease and how to keep the community healthy. On that note, we are signing off with the reminder that community and public health are a very important aspect in the healthcare field, and that without it, many communities and people would not be receiving the treatment and education they need. Thank you, and so long until next time.